Yeah, help drips. Hope you heard her. The show dedicated to the frontline workers and physicians feeling pressured, feeling overwhelmed. We want to share the tools that will help your mental health. Help drips, everyone. You are not alone. Surely you can overcome. Yeah, the world might be nonstop. Every day you put in work, but this is a show all about putting you first. Help drips. Let's go.
Good morning to all of our listeners. This is Paulicia Aguilard with Health Drips Podcast, here to bring you another wonderful show on today for those of you who are out there. First of all, I want to just say how excited we are that you are tuning in today and listening. As you know, this is Black History Month, and we've just gotten out of February 3rd, we celebrated National Woman Physicians Day. And so what better time to celebrate our love and the care that we as women put out to the world with our wonderful physician. Her name is Dr. Marquetta Giles, and she is the CEO and founder of Spinal Perceptions Chiropractic and Wellness Center. And they treat a wide variety of health ailments holistically to help restore optimal wellness to children and adults in the greater Houston, Texas area. Under the direction of Dr. Marquetta Giles, she is DC. Spinal Perception specializes in prenatal and pediatric care, personal injury, and corrective care through self-sustaining, holistic wellness and healing without medication or surgery. And that's a great thing. Dr. Giles has taught anatomy and physiology on the collegiate level and holds memberships with the International Pediatric Chiropractic Association, the American Pregnancy Association, the Greater Houston Black Chamber, and Delta Sigma Theta Sorority Incorporated. Welcome, Dr. Giles. How are you doing on today?
I'm doing great. Thank you so much for having me. I really appreciate it.
This is such a pleasure. So let's just jump right in. And Dr. Giles and I have collaborated previously. And so she is very passionate about women and helping other women, specifically in chiropractic and wellness. So Dr. Giles, tell us just a little bit about who you are and what it is that you are so passionate about, so everybody can just cue in and learn more about you.
Thank you. Well, like Paulicia stated, I am Dr. Giles. My office is 50% prenatal and postpartum. I'm one of the few Black chiros in our area who specializes in this demographic, and it's very, very important. We know the effects that Black maternal health have on Black women during pregnancy and delivery as well. So we are working really hard to bridge that gap, to decrease the necessity for non-emergent cesareans and non-emergent inductions, and to just be that birth support for numerous women here in the area. We also see adults, seniors, and those who have severe injuries, but that's just a small part. The injury part is a small portion of our practice. I think oftentimes when people hear chiropractic, they associate injury with the profession. And for us and for the profession in general, it is a very small percentage. Oftentimes the people are coming in because they're looking for a different alternative to try to address the underlying causes of any health issues they have, or if they don't have any health issues, to maintain a high functional capacity of their body and to go into that phase of consistent wellness care.
So tell me, what are some of the causes that you see patients coming in for? Because you mentioned injury is just a small part of it, but when most people hear about chiropractic care, they think, oh, the bones need to be cracked, we need to be stretched. So what are some causes that you see, even in pediatric care? Because you mentioned you help to heal a wide variety of patient issues.
Well, it's three main causes. Before the disease is even present, there's usually three underlying causes that gets the body to a point where disease may present itself. It's physical, chemical, and emotional stress. Physical stress, this starts as early as childhood. Dr. Midwife pulls you from your mom, you start learning how to walk, crawl, fall. Those small micro traumas start to add up. Then you add on improper lifting, bending, twisting, um, exercising improperly, just the day-to-day things that we deal with that we don't think about, trauma to our bodies,
Yeah.
sports injuries, to previous injuries we've experienced. So that's from infancy up until childhood. Then
Mm,
the emotional stress, you're thinking about financial issues, family and marital issues, school, work,
mhm.
relationships, money, finances. That
Yeah.
emotional stress alters how the nervous system functions. So we may be in that consistent fight or flight and don't even realize it. And we know we're in fight or flight. We're usually in that phase when we're exercising, worried, scared. But the body will go into that state when we're in a constant state of physical and emotional stress.
Mhm.
Last thing is chemical stress, what we have been exposed to, what we have ingested, what we have smelled, what we have tasted. Just and this is from infancy up until childhood. So you
Yeah.
don't realize how much that induces inflammation into the tissues and cells of the body. And that also changes the function of your nervous system. It may put you in a rest and digest phase, so you're drowsy all the time.
Yeah.
You notice that things are slower, you're not sleeping properly. So with chiropractic, we look to the spine to influence how the nervous system responds and reacts. So that
Mhm.
is our job. So when we have someone who's in a high stress state, we usually see a high cortisol level. They may be having financial issues. So we're able to look past the symptom to see if there is something underlying that is causing what they're feeling. And with the
Mhm.
pediatric population being in this pandemic, I am seeing a lot of the physical and emotional stress going hand in hand. And
Mhm.
I'm having to explain that to parents that what you're seeing as manifesting physically is really originating emotionally because they enjoy virtual school, but now
Yeah.
they're back on campus. So
Yeah.
they're experiencing physical symptoms that they did not have prior to returning back to campus. So
Yeah.
we have to address two issues. And
Mhm.
sometimes some parents don't want to have that conversation. Just fix my child. I've done it. I've done what I'm supposed to do.
Yeah.
Now get that referral out because now we need to manage the emotional and mental capacity that everything has changed for them and we don't
Yeah.
always realize side effects of them.
Yeah, and one thing that you brought up that I'm very interested about because of I'm a mental health therapist is how you said that it's related in terms of emotional, the physical and the emotional actually weighs heavy on how our body responds. So, can you tell me what do you see within the Black community? Because that is the population that you are currently serving. Not that you don't serve all demographics, but specifically, what are you seeing within our community?
Initially is denial. Because
Ah,
in my office, before, even if you try to withhold the information, we do a digital scan on the spine. It's no
mhm,
radiation, nothing to hurt or harm you. But it takes a digital picture of the health of the nerves and if they're over functioning, overstimulated. So before my staff takes care of the initial vitals, they do the scan. So as soon as I walk in, it's projected on a big screen. So I don't say anything. I just go in, allow them to continue to build up on the history and while they're speaking, I'm keeping in my mind what that skin looks like.
mhm,
So when they're minimizing the symptoms or minimizing the overall health, I can say, okay, I know you stated that there's not anything major going on, but it's red from the top of your neck, C1, all the way down to C3 or
mhm,
C7. Or
mhm.
down here in the lower back is red and orange. It's showing a lot of inflammation and pressure coming from the lower back, these nerves that control those organ cells and tissues. So, what is going on? Or I
Yeah.
touched them and they're jumping off the table and I'm barely touching. There's inflammation in the tissue. So, what is it that you're not telling me?
Mhm.
So it's first addressing the denial. And usually when we break that barrier down, it's okay, well, I don't have any pain, Dr. Giles. I said that is totally fine, but how are you sleeping? What is
Yeah.
your energy level? How's your focus and your concentration? How is
Mhm.
your diet? How is your mood? Are you snapping at everyone? And 99% of the time, when there is no physical symptom that has manifested yet, is usually some of those culprits. So it's first breaking down the barriers and getting past the fact of the denial stage and
Mhm.
acknowledging there is something going on, but guess what? It's okay.
Yeah.
It
Yeah.
is okay. So let's get to the root cause and see what do we need to do to address office. And it's just building that rapport and that initial relationship.
Well, let me ask you this because that's very interesting, that you talk and you mentioned all of the symptoms and the things that I specifically help to work with as well. So, do you or have you in the past actually seen doctors or your colleagues that are experiencing some of those same structural things within their body? They might have consulted with you and said, hey, Dr. Giles, I'm hurting too. Maybe I don't want to address some of those things, because I think that right there, what you mentioned is very, very important. So, have you experienced any of that?
I have experienced it with my colleagues. I think it's just very beneficial to have colleagues so we're able to lean and support on. And they
Yes.
will come in, Doc, I'm not sleeping. It's been a few months since my last adjustment. I need to come in and get adjusted. I do the same thing. I know when my sleep is disturbed. When was the last time I got adjusted? It's been 2 weeks. Or I'm noticing that I'm walking around and moving around slower, or my mood has changed. My energy may be a little different. Okay, did I miss my gym appointment this week? Okay, I went to the gym, but I need to make sure that I'm sleeping. So for me, it's making sure that I go. If it's not weekly, it's at least every other week. Going into my colleague's office. I need to get adjusted. I get
Yeah.
massages every week, and I encourage them to do the same, as
Mhm.
well as debriefing. As professionals, we are always on the go, and it can
Yeah.
sometimes just weigh heavy on us the responsibility of owning a clinic and then managing employees and managing staff in this position that we're in, especially our profession. We touch everyone who comes through the door.
That's right.
So if they're not feeling well, you have to be really, really strong willed and strong minded that their energy does not rub off on you. Or if
Mhm.
they're angry or frustrated because they're in pain, that you're able to recognize that and not take it personally.
Yeah.
Because that is also very important to
Mhm.
also decipher if someone is feeling that way physically and emotionally because of their discomfort, or do they have other things going on. And
Yeah.
sometimes they just need to just chat for a few minutes, so just taking an extra 2 or 3 minutes after you're done their adjustment or treatment and just listening.
Yeah, yeah. Oh, you're on fire with all of the tips on today. And for those of you who are listening, specifically physicians, we talk about support and how we can support each other. And one of the things that I continue to hear you saying is sleep. Making sure that you're getting the proper rest because of all of the things that you do and pour out onto and take care of with your patients. You want to make sure that you're getting the proper rest and that your mood is in check, that you are showing up the best that you can be. So, what do you recommend for somebody that doesn't, they're not aware of, like, hey, I'm just walking around, maybe I am hurting in my back, maybe um and I'll say this too, Dr. Giles, I have not, and I said that I would the last time that we talked. I said that I would be going in to make
Um,
sure that you get me adjusted, and I haven't done that yet. So what are some things that we need to look for in terms of knowing, hey, this, I need to go and get some assessment going on?
if you have a spine, you have a spine, you need to be in here just like a dentist. So how do I need to go to the dentist? You have teeth. And you haven't been in years. It's just the same thing. You have a spine. And like I stated before, the physical, chemical, and emotional stress that we have gone through. If you have never been to the chiropractor, coming to my office for the first time is like going to the dentist for the first time as an adult. You may have some plaque and some cavities and some things that need to be addressed. Same
Yeah.
thing as with adults. We see newborns because we are pediatric and prenatal and postpartum focused. I have kids who come in here fresh out the womb. Some of our women are do home births. They may be at the birthing center, so they may come in a day or two, sometimes the same day after their delivery, come in with themselves and their children. So it's nothing for us to see a newborn fresh out the womb. And the care that we do is fingertip pressure. Most of the babies sleep through the care, but just think about how every nerve in your spine controls all your body functions. Your
Mhm.
brain sends those signals back and forth, the body sends the signals back and forth to the brain. And if there's a misalignment in the spine, it's going to interfere with that brain to body communication. So
Yeah.
even on the very young, they need to come in because oftentimes we'll see the stress from the birthing process, they may present with some symptoms. Some,
Mhm.
even if they don't have any symptoms, they still need to get checked. Some may
Yeah.
have challenges with feeding, latching on, colic,
Hmm.
digestion, proper sleeping. And we know if baby not sleeping, mom and daddy not sleeping too.
Yeah, of course.
Yes, and then you have your adolescents. They're going through the growing pains. They're going through stress as
Yeah.
well with balance in school, maybe
Hmm.
extracurricular activities. So if they're in sports, that also plays a factor, or any type of athletic activity, cheerleading, gymnastics,
Yeah.
sitting at a desk all day, carrying a heavy backpack, emotional well-being. We have some
Hmm.
who sometimes, just the overstimulation can be a bit much for them.
Yes.
So releasing
Hmm.
that pressure off of the nervous system in the top portion of the neck can also help the body release those feel good hormones so that they can be more focused at home.
Yeah.
At school, we have kids whose grades have significantly improved because they have come into the office. We go into those teen years, maybe there's a lack of sleep, focus. Some
Hmm.
ladies are starting their menstrual cycle, and sometimes there's some irregularity with that. So we'll take a look at the spine and see there are some misalignments that support the reproductive system. So there's
Yeah.
just some things that we can help with that as well. And then well into adulthood, you name it. After you graduate high school, it's just you're working. You
Yeah.
may start a family, and trying to
Hmm.
manage all of that is a lot.
Yeah, yeah. So if you could, I know you said if you have a spine and the things that you would need to do an assessment, are
Mhm.
there any tips for those that are listening in terms of what you could do practically while you're exercising, while you're at the computer all day, if you're working from home, even those students who are online, that they're not on the campus, any tips that you have that maybe that person can do, whether it's making sure that they're sitting up straight, like what are your thoughts about that?
I always say do the best you can to take control of your schedule. I
Mhm.
know sometimes it may be challenging depending upon the jobs that we do have, but you're no good to your job or your school if you're not functioning at 100%. So at
Mhm.
least every 10 to 15 minutes per hour, 10 to 15 minutes each hour, you need to be taking a stretch break. You need to
Mhm.
be standing up, walking around, getting some water, rehydrating, getting a snack, moving around for at least 10 to 15 minutes. I
Yeah.
know the job cannot completely fold if you take that time off.
Mhm.
So, yes, and you'll be surprised how many people feel like they can't do that. You have to advocate for yourself. You have an
That's
HR
right.
department, and you have employee policies in place to where you are allowed to take a 10 to 15-minute break.
Yes.
So make
Yes.
sure you take that time off so that you can do that. Same thing with students. And I know in this pandemic time, we're very concerned about transmission of COVID, but there's still
Mhm.
a safe way to where, maybe the kids can just lean to side, taking a minute to, look down at the floor, lean their heads to the side, raise their arms all the way to the ceiling and then to the floor, just so they can stretch and move and get that stiffness out of the spine. So at the very least, take the time out, 10 to 15 minutes, to
Mhm.
stretch, move around. I have a few patients, they do a 15-minute workout each day just to get that mobility
Yeah.
function because they're busy professional women and parents. So
Yeah.
just taking that 15-minute yoga session,
Mhm.
even if you do 15 minutes each day, just complete stretching, you will notice a big difference in your mood, your body being able to release some of the stress and steam, and then you've been able to rejuvenate yourself.
Yeah, that's wonderful. So now, when you do the body alignment, does that include like stretching every part of the body as if you were going to get a massage, or is there a difference in terms of the assessment that you do?
It is different.
Okay.
What we're doing, once we do digital scan on the spine, we usually also do x-rays so we can see specifically how the spine is positioned. If there's any curves, any degeneration, or anything else
Mhm.
that we may not have known of, you'll be surprised all the things that we find on x-rays that people had no idea that they had. Some are life
Yeah.
threatening, some are things that we can actually address in the office. But what I care primarily consists of, based on what your exam findings are, we do the adjustments. If there's any muscle work, we have what we call STEM units or TENS units that we utilize to decrease the tension. And then we do a spinal rehab protocol where we have our vibration plate, which helps to improve lymphatic flow, blood circulation, reduces discomfort. If it's a scoliosis, helps to decrease that. Then we also have our wobble ball therapy, which helps to strengthen the core and loosen up the low back and strengthen, improve flexibility. Then we
Yeah.
also have our spinal traction where we're able to do that for the neck, where it's one of the exercises that patients can do on themselves, where we're trying to improve the curvature in the spine and get the pressure off the nerves in the neck, as well as we have lumbar traction where we can help open up the spaces in the joints in the lower back to help decrease the stiffness. So it's not, and then, there is some general stretching that's done,
Yeah.
but those who may need like more intense care, maybe they do need a medical massage. We have medical massage therapists who we partner with, who we will refer them out to. So
Okay.
if we need like a deep tissue, then yes, we have people who refer you out to for that. But we're primarily focused on the alignment of the spine and keeping that spine in proper position so you can function better.
Yes. Well, thank you so much for what tips you've shared for us today, because it's all been enlightening. You have gotten us together not only personally, but also professionally. So, those of you who are listening on today, physicians, we've talked about getting that supportive care, making sure that you're taking care of yourself. If you find yourself just as the working professional, dads, moms, even your family, this is something that you definitely want to invest in for your overall wellness, not just physically, but mentally as well. So, thank you so much, Dr. Giles. I want to ask you, my last question is, if we want to schedule an appointment with you, those of you who are listening and you're in the Houston area or you're thinking about coming down here, how can we connect with you, and tell us about any upcoming projects that you might have?
Exactly, yes. So if you would like to get in contact with our office, we have two ways. You can definitely always call the good old traditional old fashioned way. And our office phone number is 346-330-9876. And if it's outside of the business hours, just leave us a message. One of the ladies at the front would definitely give you a call. You can also explore our website and submit an appointment request via our website at www.spinalpchiro.com. So that's spinal, the letter P as in pumpkin, Chiro.com. We're also on social media with the exact same business names for Facebook and Instagram, Spinal Perceptions Chiro.
All
So
right.
you can hit us up on any of those three avenues to be able to come in. Some of the things that we have going on this month is we just put our press release out for the state of Black women in health through the various media news outlets. So we have our Love Your Womb that we're doing right now, of what you can do to prepare your body while you're pregnant and then after pregnancy and even before. And then next month, we're on March 9th, we're having our open house. We recently moved to a new location. Thankfully, during the pandemic, we grew so much that we needed more space. So we
Amazing.
have our new office at 1500 McGowan, Suite 140. And on Wednesday, March 9th from 4 to 7, we are doing our open house. So if you're not sure, if you want to speak with me directly, you'll have a great opportunity to talk with me one-on-one during that time as well.
That's wonderful and amazing. Congratulations on us
So,
expanding and opening up an even bigger practice. So that means that you can serve even more people. So that is exciting. I am so excited for you. And thank you to those who are listening today. Again, I will make sure to put the information that Dr. Giles has put out for you to grab that off of our podcast. Again, if you have not subscribed, go on today and subscribe to Health Drips Podcast. We are on Anchor and Spotify. We're also on Apple. So make sure that you are subscribing so that you don't miss all of the wonderful supportive resources that we are providing to you. Again, thank you again for listening on today. My name is Paulicia Aguilard, and I will see you on next week.
Thank you for tuning in. This is Health Drips. Polly here to help you make it happen like this. Frontline workers and physicians, much respect. Hope you keep on coming back, helping with your mental health. Yeah. Make sure you subscribe. Don't want to miss a thing. I'm sure you'll be captivated. Life changing, guaranteed. Yeah. Health Drips. Tune in to Health Drips. Hey, Health Drips. Subscribe to Health Drips. Let's go.